Hundreds of children from the Nelson Mandela Bay municipality are allegedly facing a severe food shortage. This is reportedly as a result of a bureaucratic bungle by the Eastern Cape Department of Social Development. The Daily Maverick is reporting that in the past 15 months, 14 children under the age of 15 starved to death, and another 216 new cases of severe acute malnutrition were reported. The University of Cape Town's Child Institute estimates that 48% of child hospital deaths in the country are associated with moderate or severe acute malnutrition. To discuss the crisis of malnutrition, Dr. Chantel Witten joins us now via Zoom. Dr. Witten, thank you so much for your time. South Africa's adopted a wide array of food and nutrition programs to try and address the issue of childhood malnutrition. Does this mean we're not getting the results, and why?
Absolutely, Tafuma. What we're seeing is that there's an increase of children dying, and we're attributing this to two things. One, children are not accessing the services that are there, so the child support grant is not enough in terms of buying food. We've seen the impact of COVID, and so households are really struggling to provide for their children. And the care, particularly in the Eastern Cape, is very difficult when children are essentially staying with their grandparents. And so it's really the older generation taking care of these kids. And so we have seen now that there are a number of children that are being admitted into hospital with severe acute malnutrition.
How does malnutrition change the course of an individual's life? This is, it's not just when they're children that this is an issue. It's a lifelong problem.
Absolutely. We talk about the long shadow of malnutrition. So children are paying right now through hunger and malnutrition right now as children, but it also transforms those children. We call it epigenetics, and it increases the risk of these children that are now malnourished, whether that is stunted or they have severe acute malnutrition, that in the future, they are the children that are going to have the non-communicable diseases, obesity, diabetes, hypertension, increased risk of cancer. So literally, the country is paying a double burden now with children being malnourished, and then into the future when these children become our sick adults.
Yeah, you mentioned the double burden of under and over nutrition in some of the papers that you've written. If you could expand on that a little bit, because it might be difficult for people to understand how malnutrition would lead to obesity and diabetes, which is something that I think people connect with a life of excess.
Absolutely. We've always talked about it as in terms of lifestyle diseases, and it was associated with being rich. But we know now that in our poorest countries, the burden of non-communicable diseases, also known as NCDs, is particularly because children are programmed from a very young age. And these children carry the risk. One, because they're not getting enough nutrition as children and not enough micronutrients to actually program them for healthy growth and development. So as South Africa, every child that's born, you get a Road to Health booklet. And we can see on the child's trajectory of growth that when they are not growing well, that we call this, again, like I said, the genetics over time is changing. And so your increased risk of having an NCD is exacerbated because of your hunger during childhood. And so we are carrying this burden as a country.
You mentioned that the food and nutrition programs that we have are facing the challenge of the children they're intended for not being able to access them. Why is that, and how do we change that? Why are the children not getting access to these programs?
In the youngest age group, so children under 2 years, we know that from the child support grant that these are the children that are actually not accessing the child support grant. And this is often because, one, the primary caregiver is not with the child, and so the child is left in the care of the gogo or is left in the care of somebody else, and so the paperwork is not being completed for those children to actually access the grant. Secondly, the services to actually access the grant is not as available, particularly in the rural areas. And so there's a lot of paperwork that needs to be done to actually apply for it. And we find that in our rural areas, many households that are eligible for the grant are not accessing the grant. And then more importantly, with the impact of COVID, the impact of unemployment, the increase of the food prices, we know that the support that government is giving through the child support grant is not enough to buy adequate nutrition for children. And so these children are really at the nexus of a poor system, households that are not being able to cope. And so we are now seeing the outcome, which is the increased uptake of children with severe acute malnutrition in hospitals. And so these children with severe acute malnutrition actually have an increased risk of dying. And so the mortality rate over time will increase amongst these children.
You mentioned there the effects of COVID, and I know that hunger must have increased with the lack of access to funds and food. But in the long term, what are we going to see after the last 2 years of COVID?
Tafuma, it's not what we're going to see, it's what we're currently seeing. So we see that food prices have increased. It is evident that, one, our rand is not buying what it used to buy. Secondly, the impact of the conflict in the Ukraine and Russia is affecting fuel prices, which has a knock-on effect on food prices. And so the poorest of households are not being able to be captured by the safety nets that government has in place. And so long-term, South Africa is going to see an increase in its, firstly, the malnutrition burden. Long-term, our Human Development Index is going to decrease. And as a country, our economic development is compromised. And already South Africa is not on track to meet the Sustainable Development Goals, which really means that the quality of life in South Africa is dropping, and the youngest citizens are paying with their lives.
Dr. Whitten, thank you so much for your time. We appreciate it. A very worrying conversation. Thank you, Dr. Chantel Whitten, a registered dietitian and expert in child nutrition.